We're doing a video series about nutrition and diet for people who have diabetes or other metabolic issues or who are simply wanting to lose weight. On the last episodes, we talked about proteins, starches, vegetables, snacks, fruit. Today, I'm going to answer that question that what is the absolute worst thing for somebody with diabetes or somebody who's trying to lose weight to do. So stay tuned. This is a really important topic. Going back to the template of the plate method, you can see the vegetables. We talked about the starches. We talked about protein. We talked about fruit. We talked about, but now how about drinks? You can see here a glass of water, which is the absolute best drink to have. It's cheap. It is low calorie. It is low carb. It doesn't have any bad chemicals, I hope, unless, there's contamination or whatnot. But, we hope that there is no contaminants there and no toxins or whatnot, that it's a good drinking water and so on. So you have those, the best option is water. But let's be honest, people drink a whole lot of other things other than water. So what are these things and can they affect diabetes or not? Let's see. This is a picture of sweetened drinks. Now, I'll just go on record by saying there is nothing worse for diabetes than a sweet drink. It's the absolute #1 enemy of any patient with diabetes. And in fact, if somebody has diabetes and they are drinking 4 or 5 sweetened drinks per day, let's say in the form of a regular soda or juice or any of these items here, or sweet tea, and there is nothing better that they can do than just stopping those sweetened drinks. If they simply stop their sweetened drinks, their blood sugar will come down dramatically, and their hemoglobin A1C, which is the average of what the blood sugar has been over the previous 3 months, will improve drastically beyond your belief. There is nothing worse for a patient with diabetes than a sweet drink. And there is nothing better for a patient with diabetes than stopping to drink a sweet drink if they are in the habit of drinking sweet drinks. Now, I want you to remember those options that are present here, because some of them, again, there are myths surrounding these drinks, and some of them think they are healthy, like the sports drinks and Gatorade and so forth. Some people think they are healthy. They are not. They are full of sugar. Now, if you are an athlete who's running marathons, then you need Gatorade. If you're not, you don't need to be drinking Gatorade. It's as simple as that. And the same thing applies for sweet tea and for other beverages of that kind, flavored water that might have a significant amount of sugar in them. You will see, obviously, a lot of lies and deception going on in the front of packets in the grocery stores. And it's a long story why that is, and how they can get away with it. I'll perhaps make a video about it. If somebody wants to ask me about it in the comment section, I'll be glad to tell you. But there is a lot of deception that goes on the front of the packet, whether it be sugar-free, no sugar added, all of those statements that are misleading and wrong. You have to avoid them. You have to trust your instinct and trust the teaching that you've received here today. And if you want to find out more about the nutritional content of what you're about to consume or buy, you need to look at the back of the pack, not the front of the pack, because there you will see that nutrition label that tells you exactly what it has in terms of total carbohydrates, sugar, and so forth. And the one thing, I know this can be overwhelming, the amount of information that you need to know. But if you have to go with one thing only, just the number of total carbohydrate per serving, whether you're evaluating a food or drink, if the total carbohydrate per serving is not 0 on a drink, stay away from it. Okay? It's as simple as that. So if you have a drink that has total carbs 0, that's fine. If it's, and you know, when I say fine, yes, there are some things we'll talk more about in a few slides down the line, but yes, that's not going to raise your blood sugar, let me put it this way, okay? But something that has a number next to total carbohydrates that is not 0, well, yes, it will raise your blood sugar, okay? And you have to be very, very careful about these things. Here is a list of some of the commonly consumed sweetened drinks and the amount of sugar in teaspoonfuls that they have. Look here, you'll obviously be surprised, or you might be surprised. Even the vitamin water that is sweetened with sugar, you'll find that it has 8 teaspoons of sugar. The soft drinks or sports drinks like Powerades and Gatorade and so forth, they have 9 teaspoonfuls. But that is it's nothing compared to sweetened tea, which is 14 teaspoons, and sodas that are 15 teaspoons, and juice, which is 17 teaspoonfuls of sugar per 1 serving. So obviously, if you're getting 15, 16, teaspoonfuls of sugar in one drink, that doesn't make you feel full at all in whatever way. It actually makes you feel more hungry because it spikes your natural insulin production and causes you to feel hunger after the meal, 2 hours after the meal. So if you're consuming that, there is simply no winning. That is why I started the talk by telling you have to cut out the sugar. You can't negotiate with the devil. You can't tell the devil, okay, well, you can come here, take over, my house, but not my body or whatever it is. You can't have that kind of negotiation with the devil or with sweetened drinks. You just have to cut it out. If you have diabetes, you have to cut it out. You can't allow that to be present in whatever amount. It's going to raise your blood sugar dramatically, and it's going to make you hungry for more, not to mention 100,000 other health problems that can happen as a result of sweetened drinks. So I can't repeat that strongly enough or emphatically enough. Again, here you can see the different drink items and how much sugar they have, and you can see here the big soda fountain soda drinks, how much sugar. I mean, this is a tremendous amount of sugar that you're putting in your body. But see, I think one of the main take-home messages from this picture is that there is no innocent sweet drink. You can't say, okay, well, it has less of a poison. It's just like saying, well, this has less poison than this. Yeah. I mean, maybe can you imagine somebody saying, for example, I'm going to be bitten by a snake. I'm going to actively seek out a snake because it's like mildly venomous, or its venom will not kill me as quickly as that other snake is bad, but I'm going to go to this snake because just stay away from the snake altogether. What are you doing? Why are you consuming sugar in a drink form? That has no place in diabetes. So yeah, I get passionate very much about these things, but I think it's just because I've seen all the damage that diabetes can do to people and how easy it is to basically switch one thing and reduce the blood sugar dramatically. So these are things that we really need to be very conscious about. So you may say, okay, I got it. No sugar in drink. I got it. But now what can I drink? So here are 2 good drinks, which is tea and coffee. Coffee is not bad for diabetes. A lot of people have the misunderstanding that coffee is bad. It's not at all, actually. It has multiple health benefits. Obviously you have to be mindful of how much caffeine you put in your body, because it's not good to have a huge amount of caffeine per day. And both coffee and tea have caffeine, but coffee has, an average cup of coffee has at least two times as much of the amount of caffeine that a similar size cup of tea would have. But it really varies depending on the brand, and some brands would have 4 or 5 times as much caffeine as even a regular cup of coffee. So, and some of the store brands like Starbucks, their coffee is extremely rich in carbohydrates. Extremely rich in caffeine. It's almost 5 times as much as regular coffee. So that's something you have to also remember when you drink coffee. But going back to the carbohydrate, what I just mentioned, maybe I mentioned it in mistake, but it's also true that depending on what you get, how your coffee is prepared, like a frappuccino or whatever it might be, they can add a huge amount of sugar to your coffee, and it becomes a sweetened drink, just as bad as all the other sweetened drinks we talked about. So you definitely don't want to be doing that. But regular coffee, or just coffee in and of itself, is not bad for diabetes, and you could give it a little bit of taste. If you cannot have your coffee black, you want something with it, you can have a little bit of cream, you can have a little bit of a sweetener if you want, in the form of stevia. Again, I think from my perspective, metabolically, and I studied all of those sweeteners, there isn't a sweetener that I would feel safe with, except perhaps the stevia. The other sweeteners have so much problems, so many problems that they can cause, and they are suspect of causing so many things. But I'll tell you something from the metabolic standpoint, is that the problem with the sweeteners in general is not just the effect of the sweetener itself on affecting your body, or whether it can cause cancer or not, or whether it can cause the other health problems or not, which there is a lot of controversy about it, and how much of the sweetener is necessary or needed to cause the harm. And obviously my standpoint is, well, if something causes harm even in only in large quantity, why do you even get it? Like, just try to avoid it altogether. But that's controversial. It's not, the FDA, for example, has not accepted the fact that or has not accepted the proposition that any sweetener whatsoever causes cancer or is responsible for cancer. But all that aside, so let's, other than that, all that aside, sweeteners such as aspartame and so forth, the main problem from the metabolic standpoint, from the diabetes standpoint, since we're talking about the diabetes here, is that it keeps you hooked on to the sweet taste. That's the bigger problem from the diabetes perspective here, is that you're going to eat more down the line because of the sweetener that you're getting. So people who, and that's an observation they found in research studies, is that people who drink diet drinks, Diet Coke, for example, or Diet Pepsi and so forth, on the long run, they gain, and I'm not talking about diabetes, I'm talking about just regular people drink, in the habit of drinking multiple diet drinks, versus people who drink multiple regular sweetened drinks, versus somebody else who's just drinking water. So think of it as 3 groups. One that is drinking, regular soda, right? Coke, for example. And the other group is drinking Diet Coke. And the third group is drinking just water, all right? So they monitored the 3 groups. And through the years, to their surprise, they found that the group that drinks Diet Coke gained weight even as much as the group that drank regular Coke. And both groups had a lot more weight gain than the group that just drank water. So why is that? You know, the diet, if the diet drinks themselves don't transform into sugar and raise your actual blood glucose level, why are they causing weight gain? Well, one of the theories is, which I think is in reality the explanation, a good explanation, is they stimulate the desire for carbohydrate and for sugar in your brain because they have a high sweetness factor. So they are size per size. Some of them are like 200 times as sweet as sugar. That affects your brain in an unnatural way. It makes you crave sugar, makes you crave carbohydrates. And a lot of people will try that experiment for themselves and notice that if they get a diet drink, okay, and try and eat healthy meal, but just with a diet soda, right? Down the line, a few hours later, they find themselves craving sugar, craving carbohydrates. Right? So it's somewhat unfair to say, well, yeah, in this drink, if we measure the effect on the blood sugar, it's not going to cause an increase in the blood sugar. And yeah, if I measured perhaps the effect on weight for this one particular drink, diet drink, for example, I'm not seeing any increase in weight. Yeah, well, that only applies if this is the last time you're going to drink anything in your life. Right. Well, if it's the last time you're going to eat or drink anything in your life, well, just like forget about all what I said. Just eat or drink whatever you want. It's the last time you're going to eat ever, right? But that's not the case, that we're talking about. If somebody is eating lunch and they're having a diet drink, they have to think of what effect that diet drink has on all future meals. So it helps them not if that meal is healthy and they have diet drink, but then later in the day, they are going to eat a lot of carbohydrates for dinner, then have a dessert after dinner, then have like a snack before they go to bedtime because they're just feeling very hungry. Why are they feeling very hungry? A part of it is because this high sweetness factor sweetener created this dependence on, or the being hooked onto the sweet taste in their brain, stimulated their brain in that fashion that it made them want to eat more carbohydrates and want to drink more sugary things, and it just got them used to that sweetness taste in their mouth that they want to kind of maintain all the time going, that they feel like their mouth has something sweet in it all the time, right? So really physiologically, we don't have to eat sweets. We don't have to eat a dessert after every meal. We don't have to eat a dessert at all, right? But it's a chemical dependence that happens at the level of the brain that a lot of us are more sensitive to than others. I know I am. If I start to eat sweets, I'm not going to stop. So that's why I try to avoid them. And if I have diet drinks, I'm just going to continue eating carbohydrates and sweetened things, and I cannot stop. So how do I avoid that? I close the door. So and a lot of people think misunderstand this reality, right? And they blame the victim. They blame somebody who's having diabetes and say, or somebody who has weight gain or obesity, and they say, oh, what's wrong with you? Why can't you just stop eating? Well, it's once you get the process going, the chemical process going in your brain, it's really, you can't stop. And some of us are wired, brains are wired differently. A lot of people are wired in that way, that once you stimulate that chemical response that is caused by high sweetness factor items, you just keep on going. You can't stop because so is there a role for knowledge? Is there a role for self-control? Yes, but it's much earlier in the process. And I'm not saying that in underestimating or ingest or anything, but if somebody had a drug addiction, okay, once you can't get them off that offending drug by saying, well, what's wrong with you? Can't you have just a little bit of that addictive substance? You just can't say that, and you know that because it doesn't make any sense, right? Because you can either avoid that substance, or or basically once you start, you can't just limit the quantity that you get of it. It doesn't work, doesn't make any sense, because the addiction is taking over. So it's the same thing. And I'm not saying that in any negative way about patients who have this wiring in their brains. I'm just telling you, I have the same wiring. If I start to eat dessert, I'm just not going to be able to stop. So how do I manage that? Well, I manage it earlier on by trying to avoid the dessert. I just don't get down that path. I try to avoid things that have high sweetness factors, right? And so on. So I hope that makes sense. One of the problems people have is they would say, well, water is boring. I just can't just drink water. I don't enjoy the taste of it. Give me something more. Can you give me something more? Okay, so one of the things that are good to have instead of simply plain water is you could have carbonated water. Okay, so it gives you that carbonated taste, which is fuzzy and just perhaps a bit more exciting than just plain water. And many of them have like some taste of some fruit or something, but is in very small amount that is not enough to stimulate the craving. So that's something you could have instead. And definitely they are way better than diet sodas or diet drinks, which combine carbonation but also the high amount of sweetener to the water. So a question that I always or very frequently get, so somebody who is drinking regular soda, and the question is, well, should they switch from regular soda to diet soda, or should they quit soda altogether? All right, well, so if they can quit soda altogether, they should. It's much better. We talked about the diet soda and all the problems that it has. Now they will face two problems. They will face, because something like Diet Coke or Diet Pepsi, what does it have in addition to water? It has the carbonation. Well, that's not a problem. You can get it from carbonated water like bubbly, LaCroix, whatever it is. Okay, what else it has? Well, it has the sweetener, which we definitely want to eliminate, and it becomes hard when you stop cold turkey, but you can at least compensate by having fresh fruit like we discussed. Yes, fresh fruit doesn't have the sweetness factor that you find in either a diet drink, a diet soda, or a regular drink, but at least it gives you some sugar that you don't stop all sugar cold turkey, and that's very hard for the person to do. But the last thing that I don't want you to forget is many of those drinks have a lot of caffeine. And if you stop cold turkey or switch simply from regular soda to just water, the caffeine withdrawal will hit you, and will hit you pretty hard. Now, eventually it will be okay and it will be good for you, but you will have a hard time with some headache and feeling and crashing and feeling bad and tired and so forth, which if you have a lot of work to do, you have to perform, you have to do your job, then you will just very quickly go back to what you know that stimulates you, which is the regular soda again. So how do you prepare if you're really wanting to stop the regular soda? So you could compensate, or you can just like account for the caffeine drop that will happen when you stop them by having caffeine in other forms. For example, in, like we said, coffee or unsweet tea. All right, so it gives you the caffeine, but it doesn't give you the effect of the sugar or of the sweetener on the brain. But let's say somebody is saying, okay, well, I really just like, I'm hooked to the soda taste and I want to have soda. So what can I do? Well, is it okay for them to switch from regular soda to diet soda? From the diabetes perspective, I will say yes, as a step. So as a step, if somebody's drinking 4 or 5 regular drinks and they just are very, very hooked to the taste of regular drinks, and they want to switch to a diet drink, is that a good thing? Yes. It is going to improve their blood sugar very, very fast. Now, interestingly, in my experience of 20 years, I have found very few people ready to do that. I've seen more people who kind of completely stop cold turkey and just switch to water, or flavored water, or like some form of a bubbly or something. Then I've seen people switch from regular soda to diet. So I'm not sure what it is, but a lot of patients who are people that I deal with that drink regular sodas, they will say, I can't stand the taste of diet soda. If I'm going to stop, I'd rather just stop altogether, in which case I'll say, fine, great. But you have to be ready, because you're going to withdraw from caffeine, especially if you're drinking Mountain Dew, which has more caffeine than even Diet Coke, or if you're going to switch from Diet Pepsi, Diet Coke, Dr. Pepper, all of those dark drinks that have caffeine in them, and you're going to switch to just a non-caffeinated beverage, you have to be careful. So how will you make up the difference? How do you prevent yourself from completely crashing and having bad headache the first few days? Well, one way is, like I said, instead have coffee. Some people use caffeine tablets, which obviously have to be used very carefully, because you don't want to take too much. It comes in tablets that you can get from the pharmacy. You just don't want to take too much. It's not a good idea to switch to a energy drink, which have not only the sugar but even more caffeine than the regular drinks. Is definitely not a good idea. You're trying to detoxify yourself, so you want to go to, like I said, water, coffee, unsweet tea, and with time the process will be easier for you, and you'll be able to completely stop, and with excellent results that you will notice on your blood sugar, and they happen very quickly too. When you're putting in, if you're drinking 5 regular sweetened drinks per day, that's 80 cubes of sugar that are no longer going to go into your system per day. Every day, you're putting in 80 grams of sugar directly into your bloodstream from those drinks. If you stop that, your blood sugar will come down dramatically. Even you have to be careful if you're on a high amount of insulin or medication, and you absolutely need to talk to your doctor before doing something like this, because your doctor may need to cut back on the amount of medications that you take for diabetes if you're going to make such a big change. It's a great change. I encourage you to do it, but I also want you to talk to your doctor before you do it, because they need to discuss with you how to back off on some of the medication, lest you drop your sugar to very low kind of results, and not that would not be safe. Another big topic that probably deserves its own video is alcoholic beverages. They affect the blood sugar in multiplicity of ways. They are not equal in terms of the amount of carbohydrates they have, or in the amount of alcohol that they have. And those are actually two separate factors. So the amount of alcohol, it doesn't correlate with the amount of carbohydrates. You have some drinks that are very high in alcohol content, such as vodka and so on, that have very little carbohydrates. And some that don't have nearly as much of the concentration of alcohol. For example, beer, it doesn't have nearly as much of the concentration of alcohol, such as the spirits and liquor, but at the same time they have much higher amount of carbohydrates in beer and in some of the sweet wines and so on. Of course, the worst ones are the ones that you add sugar to the alcoholic beverage. So, for example, there are cocktails and so forth that call for the addition of juice. Now, we just finished talking about juice and how much of sugar it contains. So having juice and alcohol together, that's not a good combination. It affects you health-wise. From diabetes perspective, it's going to raise your blood sugar significantly, but from all the bad things that come from excessive alcohol use as well are going to affect your body. So these are important matters that you need to be cognizant of. And we don't have much more time to go into it, except perhaps I'll just say this about alcohol per se, is that alcohol in excess will impede the ability of your liver to utilize glucose. So sometimes people would notice if they drank alcohol in excess and then they slept in the next day, for example, that their blood sugar will actually drop, not go high, because the alcohol prevents the liver from utilizing glucose appropriately. Now, we're here focused on diabetes and effect on glucose. So I'm not, obesity and weight management is not my main interest in this video. Perhaps I'll make other videos about that. But in this video, I'm talking about the glucose mainly. But just to mention that alcohol has a tremendous effect on preventing people from losing weight and then putting weight on people. And it does that by a variety of mechanisms. So alcohol in itself, each gram of alcohol has 7 calories. So that adds a lot of calories to your diet, okay? Just to give you a way of comparison, 1 gram of carbohydrates or protein has 4 calories, and 1 gram of fat has 9 calories. So alcohol is way up there in the amount of calories that it packs, and it's consumed by drinking, which makes it easy to consume high amounts of calories without feeling any fullness or anything like this. But also, to add insult to injury, the alcoholic beverages, alcohol itself turns off the liver mechanisms that normally process your calories and your glucose. And as a result of that, it's much easier to gain weight with alcohol, not to mention that a lot of people, when they drink, they are not mindful of the amount of food that they eat or the choices of food. It kind of removes that protective thinking or protective mechanism that prevents you from overeating or eating the wrong things. Basically, a lot of people, when they drink alcohol, they are in party mode, so they are not cognizant. They end up eating wrong things too much, and the alcohol itself, in addition to the carbohydrates or sugar that's added to the alcohol, all of that is a bad mixture that can get you several hundreds of carbohydrates, sometimes several hundred grams of carbohydrates in one meal, and perhaps several thousands of calories in just one meal, which obviously prevents the person from regulating their blood sugar or from losing weight if they are trying to lose weight. So these are a few things about alcohol. So I'll finish by saying this on this topic. Well, how much is okay? So the upper limit for men is 1 alcoholic beverage. Is 2 alcoholic beverage. For women is I'm not sure what I said. I may have, just forget. Let's start over. The maximum amount allowed for women is 1 alcoholic beverage per day. The maximum amount allowed for men is 2 alcoholic beverages per day. So you ask me what qualifies as an alcoholic beverage, and that would be beer 12 ounces, wine 4 to 5 ounces, and alcoholic, strong alcoholic drinks such as liquor or vodka or scotch, it would be 1.5 ounces, right? So that qualifies as a drink. Okay, so again, it's a maximum allowed is 1 drink for women per day, 2 drinks for men per day. Anything more than that is considered to be excessive drinking, but the less, in my opinion, the less the better, for all the reasons that we just mentioned. And let's move on to the next part of this presentation. To recap, we talked about sugary drinks and alcoholic beverages and how sugary drinks are the absolute worst thing that one can do for their diet if they have diabetes, and the importance of staying clear of those drinks. Now, please share, subscribe to the channel, like, most importantly, send this presentation or video to anybody you think might benefit from it, and stay well until I see you next time in another video.